A nurse is caring for a client experiencing the oliguric phase of acute kidney failure. The nurse is aware that this condition is highly associated with electrolyte imbalances, in addition to the kidney's inability to produce sufficient amounts of urine. Which of the following electrolyte imbalances should the nurse monitor for? A. Hypernatremia and hypoglycemia only. B. Hyperlumbemia, hypercalcemia, and hypoglycemia. C. Hyperkalemia, hypocalcemia, and low bicarbonate levels. D. Hypoglycemia, hyponatremia, and decreased creatinine levels. E. Hypercalcemia, hypophosphatemia, and decreased nitrogen wastes. The answer is C. Hyperkalemia, hypocalcemia, and low bicarbonate levels. During the oliguric phase of acute kidney failure, AKF, the kidney is unable to excrete potassium properly, leading to high serum levels that could lead to dangerous CCG changes including peaked T waves and wide QRS complexes. The kidneys are also responsible for activating vitamin D, allowing for proper calcium absorption from the GI, which becomes decreased during AKF. Bicarbonate is also handled by the kidney and cannot be regenerated properly by the kidney during AKF. An electrical worker has been brought to the emergency department after an electrical burn injury sustained while in the field. The possibility of additional injuries are greatly increased when dealing with this type of clinical scenario. The nurse examining the client should be aware that A. All patients with electrical burns are at risk for cervical spine injuries, and immobilization of the cervical spine should be a priority. B. The patient is at increased risk for metabolic alkalosis and should be receiving fluids continuously with the addition of sodium bicarbonate. C. Electrical burns are different from other burns in that the damage that occurs is readily visible. D. Massive losses of myoglobin from muscle damage can lead to liver dysfunction, thereby leading to liver failure. E. After an electrical burn occurs, the damage to the underlying tissues can continue for up to 72 hours. The answer is A. All patients with electrical burns are at risk for cervical spine injuries, and immobilization of the cervical spine should be a priority. The risk for cervical spine injury is high due to electrical workers being subjected to having to work on utility poles that upon electrocution may lead to falls from tall heights. This possibility puts the person at risk for spinal and long bone fractures. Electrical burns often lead to damage below the surface of the skin and may not be fully appreciated on visual inspection. Chemical burns can lead to continual damage over 3 days. Myoglobin in the bloodstream from muscle damage puts the kidneys at risk for damage, and the patient is usually at risk for metabolic acidosis, not alkalosis. Which of the following is an insect vector-borne illness? A. Rocky Mountain spotted fever. B. Rabies. C. Roundworm. D. Cat scratch fever. E. Scabies. The answer is A. Rocky Mountain spotted fever. Insect vector-borne illnesses are given to humans through insects like ticks, mosquitoes, and chiggers. Rocky Mountain spotted fever is caused by Rickettsia rickettsii. Ticks are the most common vector for Rocky Mountain spotted fever. Prevention of tick bites is a crucial teaching point in preventing the spread of the disease. Although misleading, the infection can be obtained throughout the United States of America. Roundworm is caused by a fungus. Rabies is a viral disease that is typically transmitted between mammals through bites. Cat scratch fever is a bacterial infection that can cause severe neurological, musculoskeletal, circulatory, and other system damage in immunocompromised individuals. In healthy people, no treatment is necessary and the infection is fought. Scabies causes extreme itchy red bumps commonly in between the fingers, on the wrist, and around the abdomen. The organism that causes this disease is actually in the arachnid family and is not an insect. Ed is an 85-year-old male who lives at a long-term care facility. He has recently begun having difficulty brushing his teeth, an activity he would previously complete on his own. He has also appeared to be more confused while engaging in basic conversation with the nursing staff. The nurse should first evaluate Ed for which of the following? A. Alzheimer's disease. B. Bipolar disorder. C. Infection. D. Creutzfeldt-Jakob disease. E. Depression. The answer is C. Infection. Changes in baseline cognition and functioning of older adults may be due to infection. Urinary tract infections frequently cause confusion. Evaluate for an underlying condition before testing for rare diseases or dementia. A 3-year-old child is admitted to the pediatric medical unit from the emergency department with suspected rheumatic fever. Which of the following is not indicative of rheumatic fever? A. A red rash over his arms and legs. B. A temperature of 102°F. C. A red rash over his chest and back. D. A history of sore throat 3 weeks ago. E. A negative titer for anti-streptyl isino. The answer is E. A negative titer for anti-streptyl isino. Rheumatic fever presents with a red rash over the trunk and extremities, fever, and a sore throat. It is caused by an untreated streptococcus infection in the previous 2 to 6 weeks, such as strep throat, and can be confirmed with a positive anti-streptyl isino titer.